Sleeping with lower back pain can be quite challenging. Many positions that we choose to sleep in often put a lot of pressure into our back. So if you're dealing with a back injury and it's an inflamed low back, that those positions may aggravate it and prolong your injury. So what we're going to go through are some tips and some strategies that you can utilize to help ease the tension out of the back so you can get a more restful night's sleep. So setting up a good night's sleep begins when you first get into bed. So what you want to first do is you want to just sit on the edge of the bed like so. Now the whole goal with getting into the sleeping position and sleeping at night is we want to try to maintain a neutral spine position. This just helps take some pressure out of the painful joints or the discs or muscles, whatever it is that's causing your injury, that we want to keep the position as neutral as possible. So it starts in a seated position and working your way down to a laying down position, that you want to move the spine as one unit like so to get into the laying down position. So what that looks like is you want to sit up nice and tall, give yourself a general brace around your abdomen to help support your back, and what you're going to start doing is tilting your body from your hips all the way through the neck towards the mattress, and you're going to start catching yourself with your hands. So then you're going to walk yourself down, and as you're walking yourself down, start elevating your legs onto the mattress and supporting your upper body with your forearms, elbows, until you're into a side position like so. Now, if you are a side sleeper or this is a comfortable position for you when you're dealing with your lower back pain, then you can just stay in this position. Now, there's a couple tricks that you can utilize to maximize the benefits of a side sleeping position. So one of the first things that you can try to help maximize the comfort in this position is placing a bolster or a pillow between your knees and your ankles. So what this will do is it keeps your legs in proper alignment through your hips. And so it keeps a little bit more regular muscle tension around the hips. It also keeps your pelvis nice and straight. There isn't any twist that's going through that could influence the lower back and exacerbate that lower back condition. So if the bolster wasn't there, the knees come together and there's just very subtle rotation and stretch through the tissues and the pelvis, and that can cause back pain, or if you don't feel it right away, after several hours of sleeping, it might just cause enough strain to then exacerbate that back condition. So this is a good place to start. Now the second thing that you can consider if you're still having lower back pain in this position is when we are on our sides, what can happen is in the lower back on the side that we're sleeping on, the back can sag down that way. So that can create an overstretch on this side, and it can also compress the spine on the top side here. So to help with that, you can use a soft pillow and put it underneath your rib cage and lower abdomen area, or you can roll up a towel like so, and you can put it right above your pelvis and underneath the rib cage. And that's just enough support to take a little bit of that sag out of that spine and can offer a little bit more support to decrease the strain into the injured area. So that can help a lot with back pain in a side sleeping position. Okay, now, the other position that can be quite helpful for lower back pain is laying on your back. Now, the setup's the same thing. You sit down on the side of your mattress and you're going to walk yourself down, keeping your torso and straight up and down alignment. You're going to lay on your side, and then from this position, your whole body, hips and everything, you're going to roll onto your back all at once. Now, in this position, if your legs are straight, what that will do is it creates an anterior tip through your pelvis, and then that will jam up your lower back, cause a little bit of extension, and that can irritate the lower back. So to prevent that, what you want to do is have pillows ready to put underneath your knees. So the pillow I'm using is specifically designed for this, but you want to get your knees relatively high up off of the mattress. So sometimes it takes 2, even 3 pillows to get the legs elevated enough. And what that does is just rocks the hips backwards a little bit, so you get a more posterior tilt or more neutral position through the pelvis. So it takes the back out of this extended position, which can irritate lower back pain, and then it just gently decompresses, relaxes the tissues around the spine, decompresses the joints, and takes some pressure off of those discs. So this can be a very good position to relieve pain if you're dealing with lower back pain. Now, final position, which I don't usually recommend at all, but some patients, they are stomach sleepers and they're always going to be stomach sleepers. So even when they're dealing with back pain, that's a position that they just need to be in because that's the way they sleep. So if you are a stomach sleeper, same thing. Walk yourself down to avoid that quick transition motion that could irritate the lower back. And then from this position, I'm going to use this pillow to demonstrate. So you're going to rotate onto your stomach. Now, when we're on our stomachs, the same thing happens when we're on our backs, is that the lower back will extend and compress those structures in the lower back, and that can irritate the lower back. So to help with that, you're going to place a pillow underneath your abdomen and the front of your pelvis, and that will lift up the lower back, decompress the back, take some pressure off of those tissues, and that can be a more pain relieving position to stay in if you are a stomach sleeper. Now, final piece. So when you hopefully get a good night's sleep and then you're waking up in the morning, you want to do the exact same thing you did when you got down into the position to sleep. So you want to, you wake up, scoot to the side of the bed so it will give you a good position to get out of the bed. And when you get up, you're going to try to keep your back in one position like so. So scoot to the side and you're going to start pushing yourself up. As you start pushing yourself up, let your legs swing off the side of the mattress, push yourself all the way up like this, so you're maintaining proper posture. And then from there, just give yourself a second. Then once you kind of get your bearing straight from waking up, then go into a standing position like that. The thing that many people try to do when they're dealing with back injury is they try to brace really hard and try to get up out of the position quickly because they think that that's going to get past the painful portion the most efficient way. But what that will do is if you're in this position, you're just trying to sit up really quick, you contract your muscles of your abdomen and the spine, and that will actually compress the back further. And then this quick motion can then increase the pressure in your back and exacerbate lower back pain. So do it very methodically, break the movements from sitting to laying down, just very compartmentalized, just break it down very smoothly like that. Try the different props when you're inside sleeping on your back, or if you do sleep on your stomach, then try the pillow underneath your abdomen, and that will allow you to hopefully get a better night's sleep and decrease the length of times you're dealing with this lower back pain.